I had worked in community-based corrective services before. I had stepped inside the walls of this particular prison. So, I had an idea of the reality that he was facing. So I was just terrified, absolutely terrified about what was going to happen from here. It's not a place that you want your family member, particularly one who's extremely mentally unwell. My name is Margaret. I support people who live with mental ill health. This is my experience. Here in Western Australia, our mental health and drug and alcohol systems operate separately. So what often happens, unfortunately, is sometimes when there's prolonged use or distress, people bounce between systems. So he would often, he would take himself off to an emergency department looking for help because of his distress. And, the response he'd get, well, we can't deal with your mental distress until you stop, drinking or using drugs. He came to a situation where just things were deteriorating over weeks. We were flagging, we were looking for help desperately, I was calling, but we just couldn't get someone to come and actually do what needed to be done. His paranoia grew and grew and grew, and he felt that, people in the community were persecuting him, that he was under risk in the community. So he decided that the safest place for him was to go to prison. Now, this is in the context of he tried to get into hospital, he tried to get into detox for drug and alcohol use, and so he committed an offence that he thought would make sure that he got into prison. So he went in, in his mid-20s to a remand centre, extraordinarily unwell, because remember the reason he was actually thinking this was a safe place was because he was very unwell, and it wasn't picked up. He said to me afterwards that he didn't want it identified because he knew he'd be much more vulnerable. So therefore he wasn't getting any medication. So therefore his condition was just worsening and worsening because he was in a place where his paranoia and his anxiety levels went up, and any treatment for that had gone. And prison, excuse the pun, is an extremely impenetrable place for families. So I was trying to be in contact with people and say, this is what this man needs, but of course he's an adult male. So there's a whole issue about confidentiality. In Western Australia as well, we have a situation where we're dealing with the mental health system, the health system, and the prison health system, none of whom talk to each other. So there was just no records going at that time from one system to the other to provide some sort of background as to what had happened. Had he been able to walk into a situation with other people of his own age where there could have been much more normalised conversation about what was going on, much clearer explanations, a better trajectory, and a really strong message that, you can and will recover from this. This is a blip in your life. This isn't your life. The problem here in WA is if someone doesn't get well and becomes and remains unfit to play, there's a very, very dire outcome. People in this situation are actually kept in prison a lot of the time. They're not in a secure hospital setting where they're receiving treatment. And the fact that they are held indefinitely at the governor's pleasure means that there's no firm date for release. And that the decision upon those reviews is made by a board behind closed doors. I often hear the phrase complex needs, and it just makes my blood boil because it makes them sound so difficult, and their needs are somehow so complicated and complex. And I don't think their needs are complex at all. Theirs or mine aren't that complex, and they're just human needs. We need to attach the complexity to the system, not to the individual, because it's how service gets delivered to people who have more than one issue. When the system works in silos, it's what's complicated. So when the individual, as in Paul's case, is flagging that they're becoming unwell, when the family are flagging that they're becoming unwell and that there needs to be some sort of intervention and support, then we need experienced people to come to the family and to the person. In a crisis situation, which unfortunately is how it often happens, we need to have a co-response between police and suitably experienced mental health professionals, and indeed a peer worker, so that we're not just actually sending the police out to be mental health professionals for which they're not trained or qualified, and it's just frankly not their job. And we're not expecting mental health professionals to put themselves in situations where they may be at risk or they may feel that they are at risk. But we actually have a really coordinated, cohesive, experienced, qualified, recovery-focused crisis emergency response.